Originally, I was born and raised in Moscow, Russia. I come from a very small family. I was the only child. My name is Elizabeth, and I'm an employee of Bristol-Myers Squibb. Growing up, I probably was not a very typical kid. The year that I graduated from high school was the year that the Soviet Union fell apart. A lot of the history books were rewritten in real time. Going to school and just living through that was an amazing experience. My parents always had this vision of an American dream for us. I was 18 when we came to New York. I was able to continue my studies. I was recruited by Bristol-Myers Squibb out of the business school back in 2001. Growing up, medicine was not top of mind for me. Coming out of school, working for a pharmaceutical company was something that was fascinating. It was different. When we came to this country, my dad got sick, and I had to navigate the healthcare system, which turned out to be a very challenging and very often frustrating experience. Patients are expected to become much more involved in making healthcare decisions. Today, I head up a team called the Patient Hub, and over the last few years, we have embarked on the journey of creating something that we're calling universal patient language, which is meant to be a capability that folks across BMS and even externally can leverage to create better communications for patients. We really focus on thinking holistically about patient experience and different interactions that patients have with various parts of Bristol-Myers Squibb, and making sure that that experience is holistic and positive. And we also have been working directly with patients on co-creating some of the materials, information, and services. All of that in an effort to, again, make sure that folks understand the information that we give them and can act on it.
Elizabeth really has a lot of empathy for patients. She has a remarkable way of being able to connect with people, help them think about a patient in a real way, and find practical solutions that energize people. At the end of the day, a patient's the person that's in charge of their own health. She understands patients. She always fights for the patient, and she knows that they're people, and that's really what inspires her.
Regardless of who you are, where you come from, we all have experience with the healthcare for ourselves or for our loved ones. As I reflect back on the last couple of years, what I'm the most proud of is our ability to get in with patients. Every single one of those interactions is extremely motivating and empowering. And anything that I can do to make that experience better is really what drives and motivates me. I work for Bristol-Myers Squibb because I'm passionate about working for patients.